Hello, I'd like to welcome you to the Foster Care Training Program. My name is Lisa Bragg, and we will spend the next hour talking, explaining, and answering questions about our foster program.
Why do we need fosters? It is proven that animals stay healthier and recover faster in home environments rather than the shelter. Reasons for fostering include medical, such as injury, surgery recovery, illness, or skin issues. Maybe the kittens are too young. Our kittens cannot be adopted until they have been spayed and neutered, and that happens at 2 pounds, which is about 2 months of age. But most of our kittens come into the shelter much younger. We do foster mostly kittens and lots of them. For the last 2 years, we have been very close to almost 500 foster animals. Another reason may be behavior. Maybe the kittens are fearful or under-socialized. Maybe they were born outside without any human interaction. We will train you to use our positive reinforcement methods. Wet food is great for making friends. The last reason is emergency housing. This could be a hoarding situation, domestic violence victim, or someone who has been affected by flood, fire, or another disaster. The number of reasons vary, but our foster homes are very important. What do you have to do? Love them. But that also means cleaning. Regular cleaning will reduce the spread of disease, lower their stress, and will keep them mentally and physically healthy. Please observe your foster animals closely. Watch for animals that are not eating, peeing, or pooping as normal. We will talk more about this later. You must keep your check-in appointments. It is critical to their health that these animals receive their checkups and their vaccines on time. Communication. Let us know how the animals are doing. If something doesn't seem right, get in touch with us. Follow our guidelines that will be laid out in the foster manual and any medical instructions that are given. Fostering doesn't come without some challenges. It can't be all fun and games. Feeding, cleaning, socializing, and handling, all very important and time-consuming. Think about your work schedule. Are you gone more than 10 hours a day? You will be caring for young kittens, sometimes with immune systems that may be weak and compromised. Sometimes they may not make it. Please know that it is not you. This is life. It is hard when a kitten passes away, but please remember it's also very rewarding to foster and save as many lives as possible. Bringing them back for adoption is not easy either, but you can come and visit and even help them find homes yourself by promoting them on your social media. Our foster Claire says, I think that something I really couldn't fathom before I fostered my first group was that giving the kittens back is simultaneously the most joyful and sorrowful thing about the entire process. It's so exciting to think about them in their new homes, as sad as it is to walk into an empty kitten room after you drop them off. Other challenges. Can you separate or confine your foster pet? The perfect foster room will have a door that closes it off to the rest of the house and no carpet. We understand that perfect isn't always an option. We try to accommodate different scenarios. The shelter team will work with you and your setup. Keeping the new foster separate from your personal pets for the first 3 to 5 days is a must. Resident pets should be in good health and up to date on vaccines. In order to foster, your cats must be current on their FHCP and rabies vaccination. Think about your family members. Does anyone have a compromised immune system? Is anyone pregnant, very young, or elderly? If you have questions, please consult your doctor. Please note that we cannot provide medical care for your personal pets. Can we talk about how rewarding fostering can be? Just knowing that you saved these lives, not to mention the amount of fun and laughter you will receive from them. Fostering is also a great family bonding experience and a wonderful way to get the kids involved. And we all know that these animals will help lower your stress level. What are our responsibilities to you? We provide all supplies. There is no out-of-pocket expense for you. We will give you food, toys, blankets, litter boxes, and kennels. We want to keep the animals on the same food to make the transition back to the shelter easier. Changing food usually leads to an upset stomach. It is our responsibility to book future appointments for check-ins and return dates. We are also on call 24/7. We will include a call sheet on who to call and when to call, depending on what the issue is. Please know that Chris Whitmore, our director, is always available via cell phone. Jen, Connie, and Lisa can be reached during business hours, and we also have foster mentors that can help. We will talk about this group of dedicated volunteers shortly. Be sure to join our foster Facebook group. We think communication is a big deal. All cats and kittens will have a vet exam prior to any surgical procedure. Kittens must be at least 2.5 pounds before they can be spayed or neutered. All cats over 16 weeks will receive a rabies vaccination. Kittens may be adopted prior to receiving the rabies vaccination. Cats over 6 months in age will be tested for FELV, FIV, and heartworm. Blood work is done for adult cats 10 years and older, a chemistry and thyroid panel due to age. The foster program is a win-win for everyone. You benefit, the animals benefit with a new trust in humans, reduced stress, quiet, comfortable healing time. Fostering also frees up space in the shelter for those animals that don't qualify for foster, or animals that are ready to be on the adoption floor. Fostered animals make the transition to a new home much quicker and easier. Due to COVID restrictions, the Animal Center is open to the public Monday through Friday, 10:30 to 5:30. For general, non-urgent questions or to request supplies, please call the center during regular hours of operation. 319-356-5295. You can ask for Jen, Connie, or Lisa. You can send an email to Jen and Connie at the email addresses below. You will need to email both of them in case one is working and the other is off. They will reply all the next day so that everyone is aware of your needs and that they are being addressed. Do not send an email if it is an emergency or a serious concern. Due to COVID, if you need supplies, you can email the request and we can place those items in the foster pickup bin outside the building. In case of bites, scratches, or an emergency, please call Chris Whitmore directly, 319-330-6380. Animal bites and scratches must be reported to the Iowa City Animal Center right away. We are mainly concerned about infection, but young kittens and puppies under the age of 4 months have not been vaccinated for rabies. The animal that bit you will need to be quarantined with us for 10 days. Please make arrangements with staff to bring the animal to us that day or the very next day. Foster mentors. After hours, we have foster mentors that may be able to help you through issues. They can take your call anytime, day or night. If the animal care technicians are at the shelter, you should go directly with them, but if not, here's a list of foster mentors. If you can't reach one, move on to the next. Callista Hospodarsky, Chris Pengash, Shelley Hall, Willa Hamilton. These mentors have years of experience and are a good source to help when you cannot reach Jen or Connie. They cannot give veterinarian advice or approve veterinarian care, but they can help you work through a kitten issue until the staff is available. The day has arrived. We have kittens or cats that need to be fostered. We will either call you or send you an email asking if you're able to foster. We will try our best to tell you who needs fostered, their medical needs, if any, and how long you should have them. If you can foster, great, but if you can't or your schedule won't allow it, don't be afraid to tell us pass for now. If you are fostering, we will agree on a pickup time and decide what supplies you will need. When you arrive at the shelter, please pull into the side driveway and ring the doorbell. The staff will load up the car with supplies, get your animals ready for transport, and have you sign the foster contract. We will go over any questions that you may have. At home. We should have already decided the best place in your house for fostering. We can't stress enough how important it is to be able to clean the foster room. Imagine your foster cat is covered in wet paint and everything they touch needs to be sanitized. All surfaces, objects, and furniture needs to be able to be cleaned. Fosters need a separate space from the rest of the house and pets for the first 5 days. Think about the cat kennels here at the shelter. Now think about the size of your extra bathroom. While you may think that your extra bathroom or even half bath is too small to house a foster animal, it is like a palace compared to the space that we have at the shelter. Be careful not to give your brand new foster too much room. Scared cats love to hide, and they're really good at it. And don't forget to pet-proof. Household hazards. Finding household hazards takes some creative thinking. Imagine what items around your home a kitten could find attractive enough to turn into a play toy. Kittens love to look out the window and check out the scenery, but they don't necessarily have 9 lives. Falls from high windows and perches can mortally injure a cat or kitten. Make sure open windows have screens to prevent kittens from falling. Cords look like a very inviting toy for kittens. Kittens love to chew and bite through cords. However, they may be in for a jolt. Put feline repellent bitter spray near cords to deter the kittens from chewing. If you want your kittens to explore and run around, you need to be able to supervise them. Kittens can choke on small coins that have been dropped. Pick up small items off of the floor. Kittens are curious and affectionate creatures. They love to help you while you cook and put away food. Just be careful to make sure that your kitten hasn't accidentally got locked in the refrigerator, and yes, that's happened. And also make sure your kitty does not jump on the hot stove and burn its paws. Sometimes cats and kittens can get inside a closed pantry. Double check and do a head count when you open and close doors. Mice and insects are a kitten's perfect play toy or treat. They're great for games of chase, and they are fun for kittens to chew on. However, mice and insects carry disease that can make you and your foster kitten very ill. Don't allow your foster kitten to play with mice or insects. We all love to have a well-decorated and welcoming home. However, some plants are downright dangerous to felines. Check plants around your home to see if they are kitten safe. Although most kittens do not love baths, some kittens may find the water fascinating. Watch your foster kitten around the bathtub, fountains, or any areas of running water. And close the lid on the toilet. Pet proofing is just like baby proofing. Setting them up. Are you using a room in your house, or will you be using a setup from us? We use plastic dividing panels, extra large dog kennels, cat havens, and playpens. Your foster animal will need a litter box and may be using clay-based litter or pine pellets. Either way, they really don't need a ton of it. We just need enough to cover the bottom of the litter box. Since it should be changed out daily, any more than that is just wasting litter. Fosters should have access to food and water 24/7 unless told otherwise. We find that putting newspaper on the bottom of the kennel helps to collect spilled water or accidents. You can use a cardboard box on its side for a hidey spot. Try to create as much space as possible between the litter box, the sleeping area, and the food dishes. And don't forget to clean. Quarantine. Keeping your foster separate from your personal animals for the first 5 days is called quarantine. This will help to ensure that any disease or illness that your foster may have brought with them doesn't transfer to your pets. The most common things we see are fleas, upper respiratory infection, and ringworm. You may even choose to have dedicated cat room clothes that you wear when interacting with your fosters. Let's try to make the travel cat carrier a fear-free experience. Here's how. For the carrier, put a towel or blankie that smells familiar to the cat. Cover the outside with another towel or blanket. Keep it elevated. Plan ahead. Don't wait until the last minute to put your kittens in the carrier. Use treats, wet food, pure chicken baby food. These are great for during and after the trip. Play soft classical music in the car. Give them time to come out of the carrier when you get home. And don't push them into or pull them out of the carrier. The next slides are going to show examples of what normal looks like, and we will talk about caring for your foster. Later on, we will take an in-depth look at illness, what symptoms look like, and how to help them recover. What does a healthy kitten look like? Healthy kittens have clear yellow urine. Dark tea-colored urine could indicate dehydration. Peeing too much can be a sign of diabetes or kidney disease. Feline urine usually has a strong distinctive odor. Kitten stools should be firm and a brown to clay color. Nursing baby kittens may have looser stools because they are ingesting their mother's milk or a milk substitute. We will discuss stool in depth in a later slide. A healthy kitten possesses no missing fur, no flaking skin, no skin infections, and has a healthy fluffy fur coat. Does your kitten walk steady? Are their legs straight and no wobbles? Some kittens are born with extra toes. This is a genetic condition known as polydactyl, but don't worry, this tends to make them even cuter. We call kittens that are 3 to 5 weeks in age transitioning kittens. This means that they are transitioning from bottle fed to eating on their own. They will start eating gruel and you may need to hand feed. As they wean off the bottle, or mom, it is important to keep dry food and water out so that they always have an option. Kittens will start eating on their own around 4 to 5 weeks in age. We give these kittens wet food 3 times a day, but are trying to switch them over to dry food. This is an important time for weight gain and socialization. Kitten kindergarten. Kitten kindergarten is really kitten socialization. Most of our kittens come in as strays and have not had much exposure to humans. We have to teach them that we are good. Start with daily, multiple short sessions. Keeping them in your foster room for the first few days will help you to see their eating and litter box habits and will give them time to adjust to your house, smells, and sounds. We think food is a great way to socialize. Sit with them when they are eating. Try to pet them a few times. You can also try playing soft music, and sometimes feel away will help with adjustments. If your kitten continues to hide, hiss, or act scared of you, please let our staff know. When you play with your kitten or cats, do not use your hands or fingers as toys. This only encourages biting. If your kitten freezes during an interaction, this is a sign that they are scared. Go slow. No sudden movements or loud noises. You can get them used to household noises slowly. The garbage disposal, the vacuum, the doorbell. Kittens learn best from other kittens. We love it when fosters can take 2 or more kittens. The main thing to watch for when dealing with multiple kittens is suckling. This can be very dangerous. It can even cause death. If your kittens are suckling one another, please separate them and call us right away. Kitten to kitten introductions. If you are only offered 1 kitten, we will try to find you another kitten that is in the same age and weight. This will be a kitten introduction. Let's all be friends. You should never just put 2 strange cats or kittens in the room together without a slow introduction. Slow introductions can be done on the opposite side of a door, while 1 kitten is in a carrier, or through a baby gate. Don't be surprised if they hiss, bat, or play rough with each other. This is normal, and the hissing should disappear in a day or 2. Please watch for a kitten that may bully the others. They may try to keep them from using the litter box or from eating the food. Moms with kittens. Are you able to take a mom with kittens? This is the best of both worlds. Mom does all the work and you get to watch these sweet kittens grow up. You may be asked to bottle feed some of the kittens depending on how good of a job that mom is doing. Our staff and our foster mentors can show you how. It is important that mom keeps eating as much as she wants during nursing. Keep an eye on mom. Is she taking care of the babies or is she trying to get away from them? Tiny kittens will meow, but it shouldn't last longer than 15 minutes at a time. Mom should be grooming them on and off all day long. Watch mom. Make sure she's eating. Is her stool firm or runny? Are her mammary glands red, hot to the touch, or rock hard? This may be a symptom of mastitis. Please keep the staff posted. Mom is doing all the heavy lifting, but we still need to monitor. We will provide a scale and a chart to monitor the kitten's weight gain. The newborn kittens need to stay in the same area as mom for the first 3 weeks. The kittens should stay as a group, and no one kitten should be cast out. If this happens, please let us know right away. If there is a runt, you may have to make sure that a nipple is available when they are trying to nurse. But all kittens should be latching on to mom. and not each other. Again, we will provide you with all the necessary supplies to take care of mom and the kittens. Challenging newborns. There is a condition known as fading kitten syndrome or failure to thrive. The kittens will be fine one day and will pass away the next. It is important to remember this is nature. There is nothing that you can do, and there is nothing that you did wrong. Watch for kittens that have a change in activity level. Make sure they are staying together as a group, no excessive crying, and everyone is nursing. Watch for sudden weight loss, kittens that may be vomiting, or kittens that may have diarrhea. While rare, a foster cat may pass away. All cats who die in our care must be returned to the shelter as soon as possible after the death has occurred. Please call Chris Whitmore at 319-330-6380 to report the animal's passing and to arrange to bring the remains to us. Please do not place your deceased animal in the freezer. Adult cats. Are you fostering an adult cat? Thank you. We consider cats 6 months or older to be adults. These cats still need an isolation period when arriving at your house. You should feed an adult cat once or twice a day. If you have a grazer, you can just leave the food out 24/7. Water should always be available. We will make sure that supplies given to you are age appropriate. Most of the adult cats that need foster care will be for a medical reason. It may be an upper respiratory infection, surgery, recovery, or depression. We also see injuries in cats that need to be on special medicine for a number of days. Help! My foster kitten is sick. Animals found living on the streets have been exposed to many pathogens. Their immune systems are weak or compromised. The shelter, even though it's a sanctuary for them, can still be stressful, and by the time they arrive at your house, boom, they get sick. The good news is that with a little TLC and the right care, they can bounce back just fine. Please be advised, even with thorough veterinarian screening, some contagious conditions, such as ringworm and certain parasites, may not be detected prior to the start of a foster period. The shelter cannot guarantee the health of any foster animals. Please watch their skin and their hair and their stool carefully for any changes. Do you have a sick kitten? Observation is critical. When your foster is not feeling well, take note of the following and call the staff. Watch their activity level and their eating habits. Look for discharge around mucous membranes, their eyes, mouth, nose, and anus. Do you see soreness or limping, maybe swelling? Some sneezing is normal. Repeated sneezing is not. What we call a snot ball, a large amount of mucus that leaves the nose during a sneeze, and also is not normal. Inflammation could be red, swollen, or meaty-looking eyes. Check your litter box, looking for quality and quantity. Their body temperature. How to take the temp. Use a dab of KY jelly on the end of a digital thermometer. This will be an anal reading. Normal body temp is 100.5 all the way through 102.5. When should I call? Emergency situations. Please notify Chris Whitmore immediately. These include difficulty breathing, erratic breathing pattern, or gasping for air, a very high or a very low body temperature, pale, blue, or gray gums, seizures or neurological symptoms, accidental injury or trauma, including but not limited to cuts and fractures, straining to urinate or not urinating for more than 24 hours, unable to stand or walk. Call the shelter or a foster mentor if there's failure to defecate for more than 2 days. If it's been longer than 12 hours for kittens that are less than 4 weeks in age, or if it's been longer than 24 hours for kittens that are more than 4 weeks of age. Not eating or drinking, if they have diarrhea, vomiting, sneezing or coughing, if there's signs of lethargy or uncharacteristic abnormal behavior, and if repeated episodes of other signs persist, such as lethargy or lack of appetite, go ahead and call the emergency number. Types of sickness. Upper respiratory virus. What is an upper respiratory virus? It's a virus that resembles the human cold. The most important thing to make sure is the kitten keeps eating and is getting enough water. A virus is not treatable with antibiotics. It will run its course. Watch for signs of secondary infection. This is when medicine is prescribed. A yellow or green mucus discharge, rattled breathing, or open mouth breathing. The third eyelid is visible. Mucous membrane is red and inflamed. No appetite at all and drooling. They may have an above normal temperature. We may ask you to use a humidifier or a nebulizer, and we will provide these for you. More on the upper respiratory virus. Symptoms include clear or colored discharge from eyes and nose, loss of appetite, depression, congestion, sneezing, coughing, and fever. Common treatments will be rest, hand feeding, warm eye compress, antibiotics, and ocular ointments. Be sure to wash your hands thoroughly after handling an animal with visible URI symptoms before contact with any other cats. URI is extremely contagious. URI is similar to the human cold, but is generally not transmittable to people or other animal species except for cats. The best treatment is rest. Be sure your kitten keeps eating. You may have to offer a variety of food. Sometimes lunch meat or scrambled eggs will work wonders. If the eyes gook up, try a warm compress. The shelter may give you antibiotics or ointments to use. Types of sickness. Vomiting. The list of causes of vomiting in cats is virtually endless. As kittens are curious and are always getting into something, they can easily ingest items that make them sick. Kitten proofing is a must. Here are the most common causes of vomiting in kittens: overfeeding, hairballs, intestinal worms, eating too quickly, viral or bacterial infections, poisons, tumors, irritable bowel syndrome, intestinal obstruction, and foreign objects in the digestive tract. Kitten vomiting can be upsetting to both you and your cat. Fortunately, vomiting in cats is relatively common and is often a benign symptom. Cats can vomit more readily than other animals. What are the causes and treatment? Vomiting in cats serves many purposes. Some mom cats will vomit already digestive food to feed their kittens. Some cats may vomit hairballs as a way of clearing out their digestive tract. Let's take a look at the science of feline vomiting. When a kitten feels the urge to vomit, you may see them excessively drooling, gagging, or coughing profusely. That is because an area in the brain called the medulla has been stimulated and triggered the vomiting response. Then the muscles in the digestive tract contract and pulsate, bringing up partially or fully digestive food through the mouth. What about vomiting versus regurgitation? The terms vomiting and regurgitation are often confused, and cats can both vomit and regurgitate food. Vomiting involves the cat bringing up digestive food. Regurgitation involves food coming up that's not digested. The food has not yet traversed its way to the stomach or intestines. This is more of a sign of a problem with the cat's esophagus, as opposed to vomiting, which tends to be a sign of the stomach or intestines. Regurgitation happens relatively soon after food has been eaten, while vomiting may occur hours or days after food has been digested. Regurgitation requires less effort on the cat's part, as the process does not involve the use of the stomach muscles. Types of sickness. Dehydration. If your kittens have diarrhea or vomiting, keep an eye open for dehydration. A quick test for dehydration is to grasp the skin behind the neck by the shoulder blades and pull up. When you let go of the skin, it should move back into place quickly. Skin that stays bunched up or tented is a sign of dehydration. If that happens, please call us. Types of sickness. Frequent scratching. Cats and kittens may scratch their body parts until the skin becomes irritated and the fur comes off. This may be a flea allergy. But your kittens have been treated for fleas, so if this is happening, be sure to call the staff right away. If you see live fleas on your kitten, a warm bath in Dawn dish soap will kill the fleas. But keeping the kittens warm and making sure they are fully dry is essential in bathing them. Types of sickness. Ringworm. Not so scary. Furless patches of skin that do not involve scratching may be ringworm. Ringworm is a fungus and not a worm. If your kitten appears to have ringworm, please contact us right away. This is a fungus that's zoonotic, meaning that it can be transferred from animals to humans. Despite its name, ringworm is a fungal infection that causes crustiness and redness of the skin, just like athlete's foot. Transmission is primarily through direct contact with an infected animal, secondarily through fomite. That's objects or materials that are likely to carry infection, such as clothes, utensils, and furniture. Treatment includes a combination of topical and oral treatments that are used to clear the infection as rapidly as possible. Typical foster length is 6 weeks or longer. Cleaning and disinfecting against ringworm should include thorough cleaning and disinfecting steps to remove the spores from the environment or contaminated objects most effectively. We will send these cleaners home with you. Types of sickness. Ear mites. Feline ear mites are tiny, pinhead-sized insects that infect the ear canals of cats and kittens. Ear mites are often described as crab-like in their terms of appearance. Ear mites can also infect the ears of other animals as well. However, humans are not susceptible to ear mites. Ear mites thrive in tight quarters. In a litter of kittens, mites can spread very quickly. The mites survive on a diet of skin tissue and debris in the ear canal. They can be quite annoying to kittens, as they can be heard moving around in the kitten ears. Ear mites can cause permanent hearing loss if left untreated. The signs and symptoms. The most common symptom of a cat ear mite is intense scratching. Kittens may experience intense inner ear itching and sensations. This is caused by the mites moving around the ear canal. Kittens cannot talk, but their actions speak volumes. An infected kitten can be witnessed moving his head around, shaking his head from side to side, scratching its ear, or rubbing its ears with its paws. Kittens can scratch their ears so hard that the area bleeds and forms scabs. Ear scratching may be more intense in the evening and night hours, as that's when the mites are active and they begin feeding. As a kitten foster, you may see a blackish-brown, crumbly discharge emerging from the ear canal. There may even be a foul odor associated with the discharge. The smell indicates there might be another infection brewing in the ear. Kitten ear mites often occur with a yeast or bacterial infection. The diagnosis. As soon as you notice the discharge from the ear and the excessive scratching, please call us. It is difficult to diagnose ear mites on your own, as ear discharge may just be a sign of another infection. The staff can rule out other problems and will examine your kitten's ear canals for the presence of mites. They will take samples of the ear discharge and look under a microscope to see if the tiny mites are present. Once a positive diagnosis is made, then treatment can begin. What is the treatment? There are a variety of treatment options for ear mites. However, home remedies are not recommended. They may not be strong enough to combat the problem. And if ear mites persist, it can lead to permanent hearing loss. Treating ear mites in kittens can be tricky. Ear mites will move outside the ear to other areas of the body to evade being killed. The best time to use medicine is at night when the ear mites are feeding and most active. The staff will give you medicine for treatment and instructions on how to use it, or they may just choose to treat the kitten themselves. Keep in mind, ear mites can also infect your other pets. Keep your infected kitten away from your pets until they are clear of mites. Be sure to launder infected clothing, kitten toys, and linens in hot water. If possible, use bleach during the wash cycle, and use the hot setting on the dryer. Types of sickness. Odd behaviors or compulsive behaviors. Have you ever wondered about your kitten's strange behavior? We have all seen kittens perform some pretty bizarre activities. Does your kitten like to eat dirt? Or does it prefer to offer you gifts of dead rodents? Here are some common and uncommon kitten behaviors: tail chasing, fur pulling, phobias, pica, wool sucking, nursing on siblings. There may be times when you just cannot figure out what your kitten is doing. Maybe they are repeatedly pooping all over the house or just playing too rough with the other kittens. You may feel like bringing your kitten back, but wait. Before you get too overwhelmed and make a hasty decision, please call us. We may decide to take your kitten to the vet to rule out any medical problems that could be causing behavior changes. Types of sickness. Feline urinary tract infection. A feline urinary tract infection, or a UTI, in kittens is not only annoying, it can be deadly. If untreated, a urinary tract infection in cats can cause severe kidney disease and kidney failure. A common feline UTI can be treated with basic antibiotics. Yet cat urinary tract infections are notorious for frequently reoccurring despite therapy. Does your kitten or cat pee just a little too often? Frequent urination is a common sign with cats that have UTI. Despite the urgency of peeing, the cat may be eliminating very little urine each time. Does your cat or kitten yelp out or meow in pain when it pees? A UTI in cats is very painful, and if you know it crying or straining at the litter box, please call us. Does your cat refuse to use its litter box? Often, cats with UTI will reject their box. A cat learns to associate the pain of a UTI with its litter box. It thinks, if I don't pee in my box, then I won't hurt so much. Kittens with UTIs like to pee in unusual places. The kitchen sink or the bathtub may become the cat's new favorite potty spot. Blood in the urine is a definite sign of a urinary tract infection or worse. Sometimes the blood can be quite obvious with a reddish tinge. Other times, blood in the urine can be more subtle. Urine analysis and cultures are usually required to make a definite diagnosis. It is not uncommon to see a cat with a UTI excessively licking or grooming its genital area. Vomiting in cats can be caused by almost anything, so vomiting in and of itself may not be much interest to you, but should always be made a note of. When vomiting is present with the above signs and symptoms of a UTI, the findings can be made. In cats and kittens, a marked decrease in appetite should cause concern. Cats can deteriorate quickly without adequate nutrition. Call us immediately if you notice that your kitten refuses to eat. Types of sickness. Diarrhea lasting 24 hours or more. Feeding your kitten too much food can contribute to kitten diarrhea. Overfeeding is characterized by large, heavy stools. It is very easy to spoil and overfeed our kittens. Fosters want to show their kittens love and affection, but moderation is in order. If you notice that your kitten is gaining too much weight, call the staff. They will give you instructions how often you should feed your foster kitten. Minor changes in a kitten's diet can cause diarrhea. A kitten may be used to a certain type of food. Sudden, abrupt dietary changes can cause your kitten an upset stomach. If the staff instructs you to change food, you're going to gradually change the kitten's food. Mix the old brand with the new brand and gradually decrease the amount of the old brand over the course of a few days. Your foster kitten may be taking antibiotics to fight off a bacterial infection. Ironically, antibiotics can cause diarrhea. The kitten's stomach has good and bad bacteria. The good bacteria enables the kitten's stomach to break down food. The bad bacteria is what makes the kitten sick. Antibiotics don't recognize good versus bad bacteria and will kill off all of the bacteria. This sets up an environment to create diarrhea in kittens. The staff may have you add good bacteria back into the stomach by giving your foster kitten a probiotic. As always, you should never give a foster animal any drugs or supplements without calling the staff first. Is your kitten anxious or stressed? Kittens are very sensitive to changes in the environment. Moving and meeting new faces can all bring about a case of kitten diarrhea. Parasites can wreak havoc in your kitten's digestive system. Roundworms, hookworms, tapeworms, giardia, and coccidia can all cause kitten diarrhea. The staff may have given your foster kitten a dewormer to help them get rid of worms. and we will talk about worms in depth in the next slide. Foster Kelly says, re-examine your relationship with poop. There will be a lot of it and in many forms. You will find it in places you don't necessarily want it. It is one of the best ways our kittens can tell you how they're feeling. The fecal scoring system. Yep, we're still talking about poop. Let's check out the scores. Number 1 is very hard and dry. It requires a lot of effort to expel from the body. There is no residue left on the ground when you pick it up. Individual pellets, this cat is constipated. Number 2 is firm but not hard. It should be pliable. Segmented in appearance. Little or no residue left when picked up. This is perfect poop. Number 3, it's log-like. Little or no segmentation. It's moist. Leaves residue but holds format when picked up. It's not bad, but it's not perfect. It's okay for now. Number 4 is very moist and soggy. It has a distinct log shape. It leaves residue and loses form when you pick it up. This is the beginning of diarrhea. Number 5, it's very moist but has shape. It lays in stacks or piles, almost like whipped cream from a can. It does leave a residue and it loses its shape when you pick it up. Number 6, it has texture but no shape. It will lay in a pile or spots. This is diarrhea. And number 7 is watery. It has no texture and it lays in puddles. This is liquid diarrhea and you definitely need to call us. Types of sickness. Kitten worms. Yuck! Just the mere mention of kitten worms can make even the most cast iron stomach churn. Kitten worms are rarely discussed, unless you work in the animal center, and these are no laughing matter. If infected with severe case of intestinal worms, kittens can become quite sick. They can infect humans, remember, this is a zoonotic, and the kittens can even die. Yes, it's hard to believe that your cute little foster kitten could be harboring parasites that can make you and your family sick. Let's look at the symptoms of these different kinds of worms. Roundworms, hookworms, and tapeworms all tend to have diarrhea as the most dominant symptom. With roundworms, kittens may present a potbelly, be somewhat thin, and may have anemia. They may vomit, have diarrhea, and may later develop pneumonia as roundworms enter into their lungs. Kittens with hookworms are often anemic. They may have considerable weight loss, diarrhea, dark bloody stool, and may vomit blood. Kittens with tapeworms may exhibit substantial weight loss, diarrhea, pain in the abdominal region, and be excessively hungry. Let's talk about these worms one at a time. Roundworms. Roundworms are the most common type of worm that affects kittens. They are estimated to be present in almost half of all young felines. What makes roundworms so prevalent is that the eggs can live in the soil for many years. Kittens can unknowingly ingest roundworm eggs when grooming themselves and licking their paws. Roundworm larvae can also be passed in mother cat's milk. Roundworms may present in stool or vomit and resemble spaghetti noodles. They can grow 4 to 5 inches long. Roundworms are diagnosed via a stool or vomit sample. Hookworms. Hookworms are another type of intestinal parasite. They are basically bloodsuckers. Hookworms attach to the walls of your kitten's stomach and feed off their blood. Hookworms are such voracious drinkers that kittens could even die from the loss of blood. Hookworms are transmitted in much the same way as roundworms. It can be through stool and infected rodents or dirt. However, hookworms have the additional ability to penetrate exposed skin surfaces. Hookworms are diagnosed by analyzing a stool sample. They can grow up to 1 inch in length. They have a small hook-like mouth, hence the name, that is used to bore into the kitten's intestinal lining. Tapeworm. Tapeworms, unlike hookworms, actually take food and nutrients out of the kitten's stomach. Kittens get tapeworms from swallowing infected fleas, eating uncooked meat, or ingesting infected animal. Fleas are a little-known source of tapeworm. Tapeworms can grow up to many feet in length. In kittens, tapeworm segments, may look like pieces of dried rice, or there may be longer, moist segments located around the anal opening. Worm treatments. Oral and topical medications are most widely used form of treatment for worms. The type of medicine used depends on the type of worm infestation and the age of the feline. Heartworm, roundworm, and hookworms are all responsive to pyrantel and selamectin. Pyrantel is known to be one of the safest anti-parasitic medicines for use in kittens. It is an oral medicine. Selamectin is a topical medicine. It is safe as well, but it is not recommended for use in kittens under the age of 8 weeks. Praziquantel is an oral medicine, and it appears to be quite effective in reducing tapeworm infestations in both kittens and cats. Animal Center staff will determine the best treatment option for your foster. Advice from fellow fosters. Cover the wall, floor, or inside the haven next to the litter box. Kittens can be messy when trying to cover up their poop in their litter box. They tend to kick feces out of the litter box. Covering areas around the box can save you time on cleaning. Kittens have very sensitive digestion. The smallest change can set off a bout of diarrhea. It happens. Kittens are small and athletic, but not always graceful. Kittens have amazing athletic skills and can climb, but are not always graceful. If you don't want something broken or ruined, put it away. Kittens should use non-clumping litter, just in case they try to eat it. If you're feeding lots of kittens, try using lots of little bowls so that every kitten can have their own spot. Restrict access to the entire house. Kittens will use their litter box if they know where it is and if they can find it in time. If you give them too much room to roam, you'll need to be sure to add extra litter boxes around the room. Kittens will chew on wires and can get into the tiniest places. You can use pieces of cardboard to block off areas as needed. Wash your hands a lot. Always ask the staff first, but you can bathe a kitten. You'll use Dawn dish soap, and you'll make sure that the kitten stays warm and dries completely. Advice from our foster Chris. You will get attached to these kittens. It's hard to remember that they belong to the center and not us. There may be times that you want to take care of a problem yourself or take the kitten to a specialist. We have a good deal of freedom as foster parents in how we dote and care for the animals, but they do not belong to us. Sometimes we have to let go. At the same time, you are their advocates for their care and health. You are the one who observes all their quirks and will need to be the first to become aware of health issues. These animals need you. You did it. You raised your kitten and helped your adult cat through a rough time. Now it's time to get them adopted. Cute pictures go a long way to getting them adopted. Please send photos to Lisa Bragg. And be sure to write up a bio. What do you want adopters to know about your foster animal? What's next? With bios and pictures, it will be even easier to get those animals adopted. When someone is interested in an animal, we send them the application. Once complete, they submit the application back to us, and then we invite them down to the shelter to meet the animal in person. If everything goes well and they want to adopt, we will schedule a time to complete the paperwork and have them pick up the animal.